Hello guys, so now we shall be discussing another opportunistic fungal infection, that would be Pneumocystis jirovecii, right? So we shall be discussing about Pneumocystis jirovecii. Now in this Pneumocystis jirovecii, the first important thing you need to know is that this is a yeast-like fungus. This is a yeast-like fungus. This is a yeast-like fungus, and how do you get it? You get it by inhalation. Now, directly speaking about in which group of patients do you see these infections most commonly? These infections most commonly are seen in the patients with AIDS. Why? Because patients with AIDS are immunocompromised. So, most common are seen in the patients with AIDS because they are immunocompromised. They are immunocompromised, right? Now, what does this Pneumocystis jirovecii basically cause? What kind of infection does it cause? So, it basically causes infection to the lung. What kind of infection? This is called as diffuse interstitial pneumonia. It would cause diffuse interstitial pneumonia, or other name for this diffuse interstitial pneumonia is Pneumocystis pneumonia. Pneumocystis pneumonia. If you look at the X-ray of this Pneumocystis pneumonia, this is how the X-ray looks. So in this X-ray, there is ground glass opacities on the right side of the lung as well as on the left side of the lung, right? So there are bilateral ground glass opacities, bilateral ground glass opacities, right? You can very clearly see ground glass opacities on both sides of the lungs. So when I do the diagnosis, so obviously I will take a lung biopsy or a lavage, I mean broncholavage biopsy, right? So when I do a lung biopsy and add methanamine, when I do a lung biopsy and add methanamine silver stain to that, so I can find this Pneumocystis jirovecii like this. You can see they are disc shaped, isn't it? So look at this picture. This is a proper disc, isn't it? So I would find, first of all, what will I do? I would do a lung biopsy. So, and then for the biopsy material, whatever I have taken, I would add methanamine silver stain. After adding methanamine silver stain, I would find this disc shaped yeast. Okay, disc shaped yeast are found. Now, when it comes to the treatment, disc shaped yeast is characteristic for this Pneumocystis jirovecii. This is very important. Now, when it comes to the treatment part, the first drug which I will be giving is trimethoprim sulfamethoxazole. Trimethoprim sulfamethoxazole. For example, to this sulfa drugs like sulfamethoxazole, to this sulfa drugs, if someone is allergic to this sulfa drugs, then I switch to another drug, that is dapsone. And remember, dapsone is given only as a prophylactic drug. Okay, you basically don't give dapsone, but you give only for prophylaxis. So not only dapsone, guys, you can also give pentamidine. Okay, and third important thing is atovaquone. So dapsone, pentamidine and atovaquone can be given. So these infections are most commonly seen in AIDS patients, right? Patients who are immunocompromised. For example, if you find any HIV positive case, and in that HIV positive case, for example, if CD4 plus cells are less than 200, if CD4 cells are less than 200 in a HIV patient, then immediately start dapsone as a prophylactic treatment. So this is all you need to know regarding the Pneumocystis jirovecii. Thank you so much for watching my video. Goodbye.